In this video, we're going to talk about a healthcare-associated infection that's much more common than Candida auris. And this one, it says, describe the characteristics of C. difficile. You might hear that called C. diff. And you might remember that that's called Clostridioides difficile that contribute to it causing an important HAI. So these pictures are right from your textbook, and it's in section 20.3. This is actually one of the most common and serious healthcare associated infections. It's not just like Candida auris, it's not typically a threat to healthy people. So again, this makes it much more commonly showing up in hospitals. It says in 2011, about 500,000 cases were in the US and about 66% of them were hospital or healthcare acquired, healthcare associated. And so this is much more common in healthcare situations. It doesn't mean other people can't get it, but it's just much more common in healthcare situations. So you might remember a little bit about this. It's gram-positive. It's an endospore former. So remember that endospores are really tough to kill. So if a patient gets this infection and the endospores from this bacteria can be found in their environment. And remember, endospores are tough. So they might be resistant to cleaning products, and they survive for a very long time on surfaces. So the fact that it's an endospore former is significant. If a patient gets this infection, it can come from the environment or from their own normal microbiota. So again, if you're a healthcare worker and you work with patients that have C. diff infections, you might pick up C. diff and it might establish itself as part of your normal microbiota. So, so it's important that you not only take care of have a lot of safety associated with your patient, but with yourself too. So you don't want this to become part of your normal microbiota, because someday you might actually get this infection. So the disease it causes, it's called pseudomembranous colitis. And this is an infection of the intestines. And you might also hear this called antibiotic-associated colitis. C. diff causes really bad diarrhea. And I've had many students that have worked with patients with C. diff. It's relatively common in nursing homes. And so patients that have worked with it, I have not, but students that have worked with it, they tell me that it has a very distinct smell. So once you smell this infection, once you smell the odor that comes from this infection, that it's very easy to identify it. So what happens when first of all, how does you get it? Antibiotic-associated colitis. I think we talked about this a little earlier this semester. When a patient is on antibiotics, you deplete some of the good bacteria in the large intestine. Some of these normal microbiota or environmental C. difficile bacteria can overgrow. They might not be as sensitive to the antibiotics, and so they overgrow and they cause an infection in the intestines, which results in really bad diarrhea. But what it can do is cause this pseudomembranous colitis. And what you can see here is kind of an endoscopy of a normal intestine. But then what starts happening when you get the infection is that they start forming these what they call these pseudomembranes. And what that is, it's their infected sites. The mucous membrane of the intestines start pulling off of the inside wall of the intestines. And what can happen is the bacteria then can infect the body. It can go through the membranes into the body cavities. And it can be just really, like I said, potentially dangerous. So, and it can definitely cause death. So C. diff is one of those that you have to be really cautious about and be aware of. It can be treated, but for some people, the treatment does not work very well, especially if they've had it for an extended period of time. If you look at, here's the next learning outcome. It says, explain how and why fecal transplants can be used to treat C. diff infections. And this is, if you're looking at your lecture study guide, it's actually at the end of the section 11.4 learning outcomes. I just thought it made more sense to move it up here, even though it was in that chapter. So it's in section 11.4, but I wanted to connect this C. diff diarrhea, pseudomembranous colitis, with one of the treatments that's being used more and more. The concept is called fecal transplants. And so there actually are antibiotics that are used to treat this infection, but remember, this infection was caused by antibiotics in the first place. So it can be complicated treating the infection, and there are relapses that occur. And some people have just a terrible time trying to get rid of this. And you can imagine this is life-changing diarrhea. This is not just a little bit. This is very serious. So what the procedure that was developed is they actually used feces from a healthy person. The very first person that this was tested on, it was a woman who had C. diff for weeks or months. And so what they did is they took feces from her husband and they put it in her intestines. And what it did is it was able to restore the normal balance of microbiota. This picture is not from your book. It's something I found on the internet, but it does give you an idea of, here they have stool harvested from a healthy donor. So they're showing you this diagram that says this is their microbiome. There's a lot of variety. So they take a fecal transplant from a donor and they put it into the patient. And if you look at the diagram of this person's microbiota in their intestines, there's not a lot, and there's not a lot of variety. There's a lot of C. difficile, there's vegetative and endospores and vegetative cells, and this bacteria also makes some exotoxins. So there's all sorts of bad things going on with this patient with C. diff. But once they put the healthy feces in that person, they can restore this to a healthy microbiome. Now, one of the first things we think of is, oh, that sounds really gross. So how do they do it? They can put feces into the patient by an enema, by an NG tube, like a feeding tube through their nose, or by pills. Now, you can imagine it's kind of tricky because you have to screen the donors. And so this is where a lot of the concern is coming from right now is, what's the mixture of microbes in the donor, and could you potentially transfer something even more dangerous to the host? So I think that's one of the areas where a lot of the research is going on about what mixture of microbes is really ideal and how do we get a healthy mixture to patients. What they're finding is a 94% cure rate of C. difficile infections when you use fecal transplants. And that's compared to a 31% cure rate with vancomycin, which is kind of one of your last ditch antibiotics. So these are for patients that are not getting better. I just wanted to show you that this is a table from your book, and it's showing you that if you look at components of a typical fecal sample, 99.8 of it, of what you find in there are going to be bacteria, and as far as cells. So most of that's going to be bacteria, and small fractions of them are archaea, viruses. Oh, there's some colon cells, protozoa, fungi. So there's all sorts of things in the feces. So like I said, this is an area that people are researching now to figure out what bacteria do you need and what things could potentially cause problems in a patient that you transferred feces to. So it's actually a little bit more complicated than it seems, but it's really promising as far as treating C. diff infections.